We're going to be setting up the Avea ventilator. I'm going to start off by placing the circuit on the ventilator. We're going to also start by assembling the expiratory side. This is your water trap on the expiratory side. What this does is if there's a lot of condensation in the filter, it'll drip down in this bottle. When it starts getting a lot of water, you need to empty it. You empty it by unscrewing it and then dumping it wherever you need to dump it. This is a weighted ball valve, so it cuts off and it should not let any pressure or gas leak out of the system. So you take it off, dump it, and put it right back on. The machine does provide a filter. This is typically like a HEPA filter. It can be reused, or I think this one is a disposable one. A lot of hospitals are going to disposable, just easier. It will go down on top just like this. If you forget, there is a housing that this goes in, and it has a picture on it. So, how do we put this together? Follow the picture. That will go in, just like that, and it snaps in. You then take it, slide it just up, you feel the snap, close the arm. Nothing in the owner's manual said anything about a filter on the inspiratory side, so we're going to skip that. And here's the expiratory side. I've already had my filter hooked, so my circuit's hooked up. I'm going to raise this just a touch. Now the on-off switch, or before we go around here, the green shows me that I am plugged up. The red shows that my battery is dead. It's been unplugged for a little while, so it is currently charging. But the meter right here shows you your battery status. On the back, right next to the oxygen hose, is the switch that you turn on and off. So you just flip it to turn it on. What I'm going to do is turn this back around, get it set up, pull the table up, zoom in. Okay. Now I'm going to turn it on. Okay. I'm going to hit alarm silence so you can not have to listen to that alarm. If you look at the numbers or the letters, it says resume current or new patient. If you hit resume current, that means you're putting it on the same patient and you have not changed anything. The circuit is the same, everything is the same. Some patients will have weaning trials, they'll do trach collar trials, they'll do different things, or maybe you're transported them somewhere and you turn the ventilator off. Every time you do a new patient or change a circuit, you need to re-perform the EST. So I'm going to hit new patient. And now it's not going to do anything until I accept it. So I'm going to hit patient accept. Now it's going to ask me my size, neo, peds, or adult. It is an adult. And I'm going to do size accept. There. Now, if you see over here it says AAC off, that is automatic airway compliance. What this does is if a patient has an artificial airway, then it will calibrate and change internally for it so that the patient is getting what you actually set. To change that, you would change that right there to whatever tube size they have, and then the total length of the airway. Okay, then if you want it on, you press on. Active humidify, it says active on humidifier. We're doing an HME, so we're going to turn that off. Now we want to perform our EST, but also leak compensation. Sorry, you want your leak compensation on. This would be if there's a small leak in the system, then it will compensate for that small leak. So we're going to Now start our EST. Remove patient and block circuit Y. I've done that, and I'm going to hit continue. Now, as you can see, it says leak test in progress, circuit compliance in progress, O2 calibration in progress. It's going to perform all three of these tests at the same time, or one after the other. So we've already passed 2. It'll do this in a maximum of 90 seconds. Whenever you do any of these tests, you want this circuit as complete as possible. If you're going to use an HME, you want an HME in line. If a lot of them are saying to hook up the active humidifier to do it, I know that a lot of the humidification chambers will leak. If you have water in the system and have already spiked the bag, spiked the bottle, that's different. That will seal the system, and you go ahead and try it. But for the purposes of the test and for this lab, we're not going to hook up the active humidification. On this one, as you can see right here, that is the patient weight. You can actually dial in their kilograms. This is ideal body weight, which will help pre-schedule the tidal volume and everything in the machine. If you see this one here, that's patient identifier. We're not going to use that. Some places will put in patient identifications, their patient number, whatnot, into the ventilator. That's just an option. We're going to hit continue. Now, we're done. We want to accept this. Circuit compliance is here. We have to hit setup accept. Now the full EST is now done, and it is ready to be placed on our patient. That is the PreUse test, or for this machine, the EST for the Avea ventilator.